Genetic assessment. Whenever discussing potentially inherited traits, it's important to obtain a family history for a minimum of 3 generations to determine if there is a potential hereditary link. Prader-Willi syndrome, or PWS, is not necessarily an inherited disorder, but rather caused by the loss of function of several of the genes in a particular region of chromosome 15. Most cases of PWS occur as random events during the formation of the female egg cells, male sperm cells, or in early embryonic development, and typically have no history of the disorder in their family. However, there is a potential of inheriting the genetic change responsible for PWS. For example, it is possible for a genetic change that inactivates genes on the paternal chromosome 15, which can then be passed from one generation to the next. Because the signs and symptoms of PWS are common to other syndromes or diseases, clinicians must be thorough in their assessment to recognize when a referral for genetic counseling is recommended, as specific tests can lead to a confirmed PWS diagnosis. Family history questions to ask would include age-related health history of anyone who may have expressed any of the following symptoms. In infancy, did anyone in the family have failure to thrive or difficulty obtaining the right nutritional needs for appropriate weight gain? Did anyone have muscular hypotonia or a weak muscle tone? Did anyone have a psychomotor delay, such as delayed speech or walking? Did anyone have genital hypoplasia or underdevelopment of genitals? Did anyone have respiratory or breathing problems, such as apnea? And did anyone have feeding difficulties, such as the inability to or difficulty sucking or swallowing? The following are questions for patients that were or are a toddler or child typically greater than 2 years of age when these expressions presented. Did anyone begin to show signs of mild developmental delay in milestones, such as taking longer to talk, processing language, or had a delay in using motor skills? Did anyone have learning disabilities, especially in reading, math, or visual perception? Did anyone have hyperphagia or severe overeating behavior and/or obesity, including early onset diabetes related to obesity? Did anyone have the physical characteristics of short stature, small hands and feet, or hypopigmentation, such as the loss of color in the hair, skin, and eyes? Did anyone have speech articulation defects, such as a disorder of speech sounds like saying wabbit instead of rabbit? Did anyone have significant behavior problems, such as psychosis or compulsive behaviors? If PWS is a suspected diagnosis, it's important to accurately assess for chromosomal changes to differentiate between PWS and rule out any other conditions related to the expressed traits. Potential disorders that could share the same expressions can include diabetes, Angelman syndrome, Fragile X syndrome, and Cohen syndrome. The suggested diagnostic test for suspected PWS is called DNA methylation analysis, which can diagnose PWS in all 3 forms and is sufficient for clinical diagnosis, but cannot distinguish the molecular class, or the deletion, multiple deletions, or no deletion of chromosome 15. To test for the molecular class, cytogenic analysis called chromosomal microarray, or CMA, is required, along with simultaneously testing fluorescence in situ hybridization, or FISH, F-I-S-H, test to determine the reoccurrence rate.
A nurse has many roles and responsibilities when caring for patients with Prader-Willi syndrome. One of the very important parts of the actions of a nurse is in the treatment of the manifestations of the syndrome. One of the most important things a nurse can do is complete a full physical assessment. By doing a thorough physical assessment, they can see how the syndrome is affecting the patient. Along with a complete physical assessment, nutrition is very important to monitor, so they can assess adequate nutrition. They can get a consult for a nutritionist and then follow the nutritionist's recommendations. Assess for hypotonia in the neonatal period, depending if you're caring for the neonates or if you're caring for children or adolescents or adults. Supervise and record their food intake, the percentage that they're eating, and the types of food that they are eating, and get a daily weight. All of these things can help prevent the obesity that these patients are at higher risk for. Another thing to help in the obesity and the effects the syndrome takes on the musculoskeletal system is to encourage physical activity and this would require getting a physical or occupational therapy consult if needed to help keep them active. More things the nurse can do is assess for cognitive impairment and degree of possible disability. Each patient is probably going to present differently with this depending how the syndrome affects them. So to get a good understanding of where they're at cognitively would be helpful for the rest of their treatment. They can consult speech therapy if needed for hypotonia and any speech-related issues. Assess their skin and monitor for skin openings, which can also lead to infections from the common skin picking, and administer medications as ordered by physician. Patients can be on multiple medications, anything from growth hormone replacement to calcium and vitamin D to avoid osteoporosis to SSRIs. So it is the nursing's job to administer these as ordered. The nursing role goes beyond the interventions involved with the physical assessment of the patient. Two important things, in my opinion, for patients and families with Prader-Willi syndrome are to continue to educate. Your patients can range anywhere from neonatals to full-grown adults, and you never know when the patient got diagnosed, if they're newly diagnosed, if they've had the syndrome for a long time. So the education to the patient and family can vary, and you never want to assume that they are fully educated and to continue that education. Another thing that's important is the emotional support you provide for the patient and the family. The family is a neonate. Obviously, the emotional support is mainly going to go to the family. But if your patient is an adolescent or an adult, you do want to give emotional support to everybody involved. There's things you can do like consulting the chaplain if the family would be okay with that. You can provide education on support groups, which I know we have listed in future slides. And you can also get discharge planning involved to help with any assistance the family would need. In the education we're given on the Prader-Willi syndrome, it does talk about how the older patients might need to be in a group home due to the developmental delays and the physical aspects of the syndrome. So providing support for that and giving them all the resources that they can be given will definitely help the family.
All testing is voluntary for the patient and/or family members. Clinicians must take special care in maintaining confidentiality and privacy of the test results. The right to privacy protects the patient from exposure of genetic health issues, but also protects the right of privacy for the extended family as well. Clinicians should encourage families to disclose the results of genetic testing to other family members to allow others to be proactive in the health of future children and/or generations, as well as potentially expedite early detection and treatment of the syndrome in other relatives that may be presenting with some of the aforementioned symptoms.